Providers and the EHR infrastructure. Healthcare providers must use standards internally during the implementation of an EHR, including user access, documentation standards, decision support, and data dictionary. These standards will confirm that providers have a general comprehension and of the procedures associated with the EHR, and that they are consistently using it across the organization. These procedures may differ based upon the role of the user, so it is important to note that the standards may be different from one organization to the next. User access, let's talk about that. So this is the levels grant system users permission to use areas of the EHR that are associated with the roles within the organization. So give you an example, a nurse would need access to nursing notes and medication administration. So there's a level of access that she would need to have in order to access medication and the nursing notes. So there's a need to know, right? There's also documentation standards. So clinical and non-clinical staff must follow documentation standards. And these standards address timeliness for documentation completed, and they require that the medical record documentation is accurate. Then you have clinical decision support, which helps providers diagnose and provide treatment to the patient. So the CDS provides clinicians with relevant options during treatment by integrating data from various systems to help with the documentation. The CPOE, and it also determines negative drug interaction using warnings and prompts to assist providers with decision making. There's that data dictionary, which is also known as the metadata repository. Now, it is a repository of data elements used in a information technology system used in the healthcare organization. So due to the enormous amount of data elements used in the healthcare, there has to be a process to organize and establish consistency in how the data elements are used and what terms will be used. So this gets into that data. We talked about information governance. Well, that gets into, or this component, that data dictionary gets into that data governance component. And then there's the EHR design. This is one of the most critical undertakings that a healthcare organization can be involved in. Meeting the needs of an organization involves an effective review of all of the essential components that's going to be involved. So before moving into the design phase of an EHR implementation, it is important to understand how an organization's system, processes, and workflows are handled prior to the implementation of an EHR. So let's talk a little more about the data and the information, but we're going to talk about it from the EHR perspective. So data and information in the EHR are derived from structured data and unstructured data. We talked about unstructured data in the beginning of a couple of chapters prior to this one. Unstructured data can be videos, voice, and image data. Most, if not all of these data can be transformed into information. So this information can be presented in tables, graphs, charts, dashboards, spreadsheets. Unstructured data would be typing free text into an additional information field to provide further information. So it's not a standard field. It's a free text field. Some of you all may be familiar with this field in your work today. So as we get into non-clinical information, what is it? Non-clinical information helps manage a patient's identity. It is commonly known as administrative information that is collected to identify a patient at the onset or prior to admission or appointment. Documents containing patient identifiable information should be the only information maintained in the patient's medical records, such as the patient name, address, phone, age, date of birth, insurance information, etc. Clinical data, the preliminary information derive the admission location that the patient will be assigned to. So it is collected during the registration process, and that data is the admitting diagnosis, the primary diagnosis, as well as the secondary perioperative diagnosis, as well as the medication and allergies, and there's more. Documenting in the EHR, information contained in the EHR can be identified as a part of the legal health record or a designated record set. It is important that every aspect of treatment be documented. The legal health record is defined by the health care organization. It can include paper and electronic health information. The EHR contains many different documents that are generated and located from the patient's initial encounter to the last encounter. So this includes information that was generated from another provider, and it is scanned to the patient's chart. Clinical staff originates the majority of the documents that are in the health record. So clinical documents include, but are not limited to, the following documents: the medical history, which is captured. It captures an account of the patient medical experience. Their experience can include inpatient and outpatient historical information along with the patient's history of medication. Then you have the physical examination, which provides objective information on the patient condition. As mentioned earlier, the CMS condition of participation required the physical examination to be in the medical record within 24 hours of admission or registration. You have the physician order. This is a technology advancement have taken hospitals to the era of CPOE. We talked about this, the computerized physician order entry, and it is a prescribing system that physicians use to write prescriptions and send them electronically. Outpatient services, they are provided in various departments. The patient come in and leave on the same day of services. So for example, a patient scheduled for an annual mammogram in the radiology service department will be an example of an outpatient service. Specialty care. Documentation in specialty records can be unique and specific to the practice. The requirements dictate what specific data elements must be captured in the specialty care setting. There's discharge summaries. It is a reference document for the patient following discharge. It is a detailed account of the patient's course of treatment throughout the patient's hospital stay. So Joint Commission mandate the discharge summaries include the reason for hospitalization, significant findings, procedures of treatment provided, patient's diagnosed condition, patient and family instructions, as well as attending physician's signature. And then last but not least, the autopsy report. This provides detail of the examination of a body after death to determine the cause of death. Now, this report is also called the CORPSE or post-mortem examination report. So this concludes this part of our session.